Hi, Dr. John Torres here with NBC News on this Facebook Live, where I bring you headlines you've probably heard over the past few days, maybe over the last week or so. Explain what those headlines mean, and particularly what they mean for you, your family, your loved ones, and your community, and hopefully give you some information you can walk away with that'll help you get through the pandemic a little easier, hopefully a little sooner, and certainly a lot safer. And then I'll take some questions you have. So if you have questions, please send them our way. Love answering the questions. They're fabulous. And they're the things that you really want to know. And so that's why it's important to me to hear your questions. But let me start with the headlines. Last week, if you remember, if you saw my Friday Facebook Live, the FDA had just given an emergency use authorization for the Moderna vaccine. Go back a week, the same thing happened for the Pfizer vaccine. So the FDA gave their authorization, the CDC gave the recommendations on who should be getting it, when and how they should be getting it. And then from there, it proceeded on to distribution. This is the Pfizer vaccine. It was distributed across the country last week. So far, around 500,000 people have gotten it across the country, and those are people that are working in healthcare facilities. Those are healthcare workers and people and staff at long-term care facilities. Well, this last week, similar thing happened. Similar type situation happened with the Moderna vaccine. Now, these vaccines are very, very similar. One, the Moderna has an efficacy of 94.1%. The Pfizer's 95%. So they're essentially the same. The side effect profile was essentially the same for the most part. Minor side effects. People complained of injection site soreness or redness, low-grade fevers, fatigue, headaches, those things you typically get with vaccines, which are a sign of your immune system kicking in and trying to get those antibodies developed. So if you do get the virus, it can fight it off very robustly. And so they showed those minor side effects. Both of them had some side effects like Bell's palsy, which is a facial nerve issue. Usually you have one side of your face that's affected. And it usually resolves. Not always, but usually resolves on its own. With the Moderna one, there were 4 cases of the Bell's palsy. Only one was in the vaccine group. The other 3 were in the placebo group. So it's fairly certain it didn't happen because of the vaccine. And it happened like it normally would at the rates it would normally happen in society. These people had not gotten the vaccine. So again, they're looking at that and they'll continue to follow that. As you remember last week with Pfizer vaccine, there were some allergic reactions to it, and they're looking at that to find out why that might be happening. But so far, the CDC's recommendation has been, if you're getting the Pfizer vaccine, if you've had an allergic reaction to any components of the vaccine or an allergic reaction to a severe allergic reaction to vaccines in the past, then you probably want to talk to your doctor about whether you should be getting this or not. Now, on top of that, so again, remember last week they're doing a similar thing with the Moderna vaccine. So with the Moderna vaccine, it went through the VRBPAC committee, which are the experts that give the FDA advice. They advised the authorization. FDA did that on Friday, and then on Saturday, ACIP met. That's the Advisory Committee on Immunization Practices. They met, and they decided, okay, here's who we're going to recommend and how we're going to do this. And they recommended essentially along the same lines as the Pfizer vaccine, that it was going to be given to those, the healthcare workers, those in long-term care facilities, what they call the Phase 1B. And this is essentially the second headline is the ACIP actually met a second time, and they decided Phase 1B and Phase 1C. So now we have the way this vaccine is being distributed, because the vaccine, there's not enough to give everybody their vaccines all at the same time. So they're going to have to do it over the next few months. And the way they have decided to do this are through phases, phase 1, 2, 3, and 4. Well, they fine-tuned phase 1, and that's what they've done. ACIP met a few weeks ago, and they said, okay, phase 1A are going to be healthcare workers and those in long-term care facilities and the staff that takes care of them. Because those are the ones that are most likely to be exposed to coronavirus. Those are the ones that are most likely to be affected by coronavirus and have complications from it. So that's phase 1A. But they hadn't yet decided on phase 1B or 1C. Well, they just decided over the weekend on phase 1B and phase 1C. And what they're doing is they're incrementally opening it up. So phase 1A, again, that's healthcare workers and those in long-term care facilities. They think around 24 million people are in that category. And this tells you why they're going through phases like this. Of those 24 million people, there's going to be about 20 million people that can get vaccinated fully by the end of the year, or at least close to the end of the year, because they expect to have 40 million vaccines. 40 million vaccines is for 20 million people because it takes 2 for both the Pfizer and Moderna vaccines to get fully vaccinated. And so there's not even enough to cover that phase 1A group, but they think that'll be covered fairly quickly in the middle of January. And then after that, they're going to start in phase 1B. What they decided on phase 1B are those old 75 and older, so 75 years old and older, and essential workers. And the essential workers, or at least part of the essential workers, what they're talking about are the first responders. We're talking EMS, police, fire, those first responders. Also, what are considered essential workers. And essential workers are, besides those first responders, also people that work in the postal service, people that work in our grocery chain, our food chain, so anywhere from farmers all the way down to somebody working in a grocery store. They're saying that chain of people supplying our food need to be protected as well, to protect them and to protect our food supply. And then they said, okay, after that, we're going to go into phase 1C. Phase 1C are 65 to 74-year-olds. So that way they cover 65 and above, 16 and above with underlying medical conditions that put them at higher complications for issues from coronavirus, diabetes, obesity, those type cancers, those types of conditions, and other essential workers. So these are the ones that weren't included in the phase 1B. So these are other essential workers, which are essentially, judges, lawyers, media, these types of things that kind of keep society going and keep information flowing are in phase 1C. After that will be phase 2, and teachers as well in that phase 1C. Phase 2 will be everybody else essentially. And they think that everybody else will start getting their vaccines probably springtime frame. If you listen to Dr. Azar, who runs the HHS, the Health and Human Services, he thinks springtime. If you listen to Dr. Fauci and some others, they think late springtime, maybe summertime. So somewhere in there, depending on the supply and the amount of vaccine we have, and how many people frankly take the vaccine will depend on when you can get yours. Now, the big question always comes up is, how will I know, and where can I go to get mine, and do I have a choice? Well, as far as how you know, right now, different hospital systems, different physicians' offices, pharmacies are putting out notice, hey, we don't have vaccine at this point for you because all the vaccine to this point has been distributed to the hospitals. But we're going to notify you when a vaccine is here. In other words, don't call us, we'll call you. You don't need to call us, waste your time calling us. So we'll go ahead and let you know when it's available. So you'll hear it through pharmacies, doctors' offices, hospitals, public health departments. They'll be sending out the notice. Now it's time for people 65 and above. Now it's time for people with medical conditions. Now it's time for first responders, that type of situation. And then you can go get your vaccines. Where can you get them? Well, the Pfizer vaccines right now are at hospitals and pharmacies for the most part. Probably not so much at doctors' offices because it takes that ultra cold storage, that minus 70 degrees centigrade, which is special equipment. Some might be, but for the most part, probably at these bigger locations. Moderna can be stored at regular freezer temperatures for a few months, and for up to 30 days it can be stored at regular refrigerator temperatures, and so it's going to be much easier to store. No special equipment required, and so those are the ones you're going to see more at doctor's office, at smaller pharmacies around the country. And right now Pfizer said they're going to distribute Moderna over the next few days to all 50 states. Thousands of locations they'll be distributing, so you'll see many more Pfizer shots available out there. And as far as the choice, some places may or may not have more than one vaccine. Most likely your doctor's office will have one type, and that's the one you should get. Pharmacies, CVS just told us today, they wrote to NBC News and they said, we are going to have both vaccines and we're going to give people the choice of which vaccine they want, depending on availability, so depending on location. But if they have them both, they're going to give people the choice, is what they've told us. And so again, we're watching this roll out. It's going to roll out fairly quickly, but people need to get the vaccine. And I've heard stories of some hospital systems where a large number of people are getting them. I've heard stories of other hospital systems where not as many people are getting them. And so I think as time goes on, we'll see people having no reactions to this, getting vaccinated, being protected from the virus, and more people will start getting vaccinated, and hopefully that'll help out. And the reason that's important is because of this third story. And you might have heard about this variant strain that's occurring in the UK, in England, in London in particular. And let me explain a little bit what happens here. So the virus, if you think about the original virus, which is the Wuhan virus that came out of Wuhan, China back in December timeframe, that virus essentially does not exist anymore. That is the coronavirus, but that strain doesn't exist anymore because the strain has changed so much. And this is very typical of viruses. This is how viruses live and how they change throughout their lives. Viruses replicate very quickly, and because they replicate very quickly, they're able to adapt and change very quickly. And that virus, the original one that was in Wuhan, China, has changed to the point where it's not even necessarily the same strain as it was back then. Doesn't mean it's a different virus, it means it's a different strain of the virus. Well, right now in London, they have found another strain that they said basically makes it much more likely to be transmissible. So in other words, that people are able to spread it to somebody else much easier, much quicker, and much more readily. The issue is that we don't really know exactly much beyond that, because a lot of this is done in the lab or looking at statistics. A lot of this, it's been so new that the research is still primary in all of this. A lot of experts are saying, hold on a minute, this is very typical for viruses. It happens. And it doesn't really change treatment. It doesn't really change the vaccine, because the vaccine should still be effective against it. But what it does underscore is the fact that we really need to double down on our efforts to stay protected, to social distance, to avoid large groups, not travel, wear masks, all those things we've been talking about. Because what can happen here is in London, they had what they call a soft lockdown, which is they locked down a few things. They basically shut down a few areas, but kept a lot open. And they think that facilitated the spread of this new strain. Now, a lot of times when you say new strain, people get concerned that this thing is mutated to the point where it's a different virus. It's not. And that's the way viruses work. So it's a new strain of the virus, which means part of the virus, in particular part of the spikes, which are the things that attach it to the cells, have changed just a little bit, enough to make the attachments a little bit different, but not enough to make it so that our antibodies, if we get the vaccine, won't work against it. So they're going to continue to monitor this. They're going to watch it in other parts around the world. If you've heard the news, other countries have shut the UK out, saying you cannot travel from the UK to certain parts of Europe. You have to be careful traveling to the United States from the UK, those types of things, because they're concerned about the spreading. It's possible that the horse is already out and the barn door is closed after the horse, because it's possible that the strain has already gotten out there. Time will tell. But even if it has, we've had episodes of other strains cropping up that were different than the original strains and that proved more transmissible. Just have to keep an eye on it, make sure that we get it under control. And by far, the easiest way to control these continuing changes in the virus, which are normal for a virus, is to control the pandemic, because the more it spreads, the more the virus is going to mutate. The more it mutates, the more chance it has to mutate to something that's going to be harder to control. We're not at that point yet, but it's possible that could happen. So again, going over the news here, Moderna got their emergency use authorization. CDC recommended how to give it, and shots are going to start being given in arms any day now. They're being distributed across the country. The CDC came out with their phases. They had already agreed on phase 1A. Now they've agreed on phase 1B and 1C, and they'll subsequently agree on the other phases as more vaccine becomes available. And of course, the strain that's occurring in the UK, the coronavirus strain, it is a changed strain. It's a mutated strain, but it hasn't changed or mutated so much that it's a different virus, or it's a virus that is resistant to the vaccine or to our antibodies that the vaccine develops. And so again, something to keep in mind, that we need to keep that under control by keeping the pandemic under control. But now, let me see if you have any questions.
Once you have both the vaccines, how long does that protect you?
So once you have both of the vaccines, how long does that protect you? And I want to take a little bit of a step back. So when you get the Pfizer vaccine, you need to get 1 and 2 of the Pfizer vaccine. When you get the Moderna vaccine, you need to get 1 and 2 of the Moderna vaccine. And I know this isn't the question, but in the past people have said, what if I get Pfizer for number 1 and Moderna for number 2? That probably won't work too well, because number 1, they weren't studied that way. Number 2, there's a little bit differences in the virus, and so they're going to activate your system a little bit differently. And what will happen is you'll essentially get two starter vaccines, and won't get a booster vaccine, which is important in that second vaccine you get. So if you start with Pfizer, get Pfizer number 2. If you start with Moderna, get Moderna number 2. But once you get that vaccine, so research is showing that there is a little bit of protection after getting that first vaccine, but we don't know how well that protection is or how long it lasts, because that wasn't studied. What was studied, we're getting the 2 vaccines to get you up to that 94-95% level. Once you get that second vaccine, which is essentially the booster, your immune system takes about 2 weeks to develop enough antibodies to develop a robust enough response to start fighting off coronavirus. And so think of it, it depends on which virus. If you get the Pfizer one, you get it at day 0, number 1, and number 2, you get at day 21. If it's a Moderna one, you get at day 0, day 28. And essentially, there's some leeway in when you can get it. And for the most part, if you don't get it on that exact day, you can get it a few days afterwards without any issue. But remember, if you get it on day 28, you have to go 2 more weeks to get that full protection. But regardless of getting that full protection, and I know a lot of people have a question, once I get the vaccine, Does that mean I still need to wear a mask? Does that mean I still need a social distance? Yes, for a couple reasons. One, because we want to make sure fully that this vaccine, we know it protects you from getting COVID. What we don't know, because the studies weren't done because it was developed so rapidly, is we don't know if it prevents you from transmitting COVID if you're asymptomatic. So if the virus gets in your body and you start transmitting coronavirus. So the virus gets in your body, you don't develop COVID, but you still have the coronavirus in your body. Is it possible to transmit? We don't think so, but we don't know for sure. And that's why we want you to wear masks, social distance, wash your hands until we get the pandemic under control.
There's quite a few questions about the mutation in the UK. With that mutation, should we expect the vaccines to change? And what do we have to worry about the UK mutation?
Yeah, and there are a lot of questions about this mutation in the UK. And the mutation is, the word I like to use is a variant strain of the original strain out of Wuhan. And this strain has changed consistently. If you look at the virus, there's different parts to the virus. It gets concerning if the spikes on the virus, it looks like a ball with spikes on it. Those spikes, if those start changing, it gets concerning because that's what the vaccine is targeting. That's what some of the therapeutics, as in the monoclonal antibodies, are targeting. And so if those change too much, then that can cause a concern. So far, the one in the UK has not changed enough to cause a concern when it comes particularly to the vaccine. The vaccine can still handle it for a couple reasons. Number one, again, the strain itself, the spike hasn't changed that much. But number two, when you get the vaccine, you get what are called polyclonal antibodies. You get a variety of different antibodies to attack it at different angles. And so even if that changes enough to where it stops one antibody from attacking it, other types can certainly attack it as well and keep it under control. So looking at that virus, the concern is not that the vaccine won't work. They think the vaccine will still work. The concern is that change might continue to go on. And that's why we need to stop the cycle of that change by stopping the spread of the virus. That's why they're locking down London. That's why they're preventing transportation outside of London. But for now, all the changes we've seen, the virus can still attack those changes. The therapeutics can still attack those changes. And this is very common for viruses to undergo these small changes. This one in the UK is bigger than most of the ones we've had in the past, but at the same time, it's still small enough to be under that umbrella of still being coronavirus, still being susceptible to the vaccine and our therapeutics.
Are both the vaccines now, Pfizer, Moderna, made from dead virus?
Neither one of the vaccines is made from dead viruses. There are some vaccines that we take that are made from dead viruses. These two are not. They're made from what's called mRNA, which is messenger RNA. Basically, it's a little snippet of genetic code that they put inside a lipid shell and deliver it that way. When it gets into the body, that causes the body to produce essentially that spike protein. So it's not the virus itself, it's just a spike protein that can carry the virus in. But since it's inside our body, there's no virus associated with it. And because it's that spike protein, it primes our immune system to fight off that spike protein. That way, if it does see the virus coming in, the first thing it's going to see is that spike protein, because that's the outside of the virus itself. All the material that lets the virus become live and do what it does are inside that little shell with the proteins on the outside. And so since our body is tuned to fight off that spike protein, it's going to fight it off before it even gets to a cell. And so that's why it's important. And that's why with these messenger RNAs, it's a new technology, but a new technology that's shown to be very efficient, again, 94-95%, and very safe.
Is the vaccine being distributed to other countries besides the US and the UK?
So the vaccine being distributed to other countries, it is at this point. And if just now, I believe the European agency, their FDA equivalent, is looking at it as well. Once they approve it, it'll be distributed as well. There are other vaccines. China has a vaccine. Russia has a vaccine that they're distributing across different areas. But as far as the Moderna vaccine right now, from what I understand, is US-centric. The Pfizer vaccine is going to be distributed in other countries, along with us and the UK. And so remember, this pandemic is on a global stage. And so even though we get the pandemic under control here, if we don't get it under control in other parts of the world, then it can cause issues. And that's why, number one, the Moderna one, which only takes refrigeration, is good because they can get to more rural locations. And even more so, the AstraZeneca one, which is the one developed out of Oxford, even though it doesn't look like it's quite as effective, doesn't take as much handling, as much refrigeration, so it could go even to more remote and rural areas, which can certainly help get this under control globally.
Why are Hispanic people dying at such huge rates from COVID-19?
And that's a great question. If you look at ethnic minorities around the country, they're having higher rates of both COVID and death rates from COVID. We think there might be a couple reasons behind it. It's possible there's a genetic component to it that's similar to people inside that ethnic minority, but we think it has more to do with their lives. Basically, the fact that where they are, where they live, how they're disproportionately poor, living in areas where they share facilities, share living spaces with other members of the family or other families, and they have work where they have to go out to work. They can't stay home. They can't work remotely like a lot of us. And so we think that combination, the disadvantages they have, are causing them to be more susceptible for catching the virus, getting COVID because of the virus, getting complications, and unfortunately dying because of the virus. And this is something the CDC has been looking at and struggling with, of where to prioritize them in these groups of workers, these groups of people across the country. And so far at this point, they've not addressed it through ethnic or minority races. Instead, they've addressed it through conditions in their lives that can put them at higher risks, as in if they're essential workers, if they have medical conditions, those types of things. It is causing a bit of a controversy, but the CDC, again, is struggling with what to do with 330 million people and getting the vaccine to those who they think need it the most. And they have had very, very vigorous debates over this. But again, great question. These have all been great, fantastic questions. Any more?
I have one more.
Okay.
What makes the virus spread so fast? Makes it contagious?
So the virus is contagious for a couple reasons. This one is contagious because it's a novel virus. And when a virus is novel, our bodies don't know how to deal with it. And since our bodies don't know how to deal with it, if you think about the cold, if you think about these other viruses that are out there, our bodies have been exposed to it. Let's take the common cold, for example. So every time the cold hits, our bodies, our immune system, for the most part, can mount a defense very quickly. And that's why the colds only last a few days, and they don't spread all that far. This virus is a novel virus, and so what happens is it gets into our body, our immune system hasn't recognized it yet, so it's kind of asleep at the wheel, watching this virus does its thing inside the body, and after a few days, once it starts building up to a higher level, then the immune system starts kicking in, going, we need to take care of this. By that time, they're behind the 8 ball, and so they're fighting against a virus that has really multiplied in the body. Once it multiplies in the body, your viral load goes up. Once your viral load goes up, it's easier to spread through coughing, sneezing, talking, singing, any of those things. And this virus in particular is a respiratory virus, and so it spreads through the air. And so you can imagine, and plus 40% of people with the virus don't even have symptoms of the virus. And so the fact that people without symptoms are out there with the virus spreading it, people who have the virus haven't started their symptoms yet because the immune system hasn't kicked in yet. They haven't started getting symptoms yet, so they're spreading it. The immune system is delayed in fighting it off, so they're spreading it. All that combines to getting this spread much, much easier and much more across different areas, through different people and through different communities. And that's why you've seen this take off so quickly. If you look back at viruses that have hit new viruses, novel viruses, this is a very similar pattern. It's usually about a 2-year pattern as it rotates around the earth before our bodies start getting used to it, and we can start fighting it off earlier rather than later and start getting some of this under control. This one is a little trickier too because, again, some of these variants have changed a little bit. It spreads a lot faster, and you have that 40% component that don't have symptoms and can spread it without even knowing they're spread it. And that's the reason you're seeing it spread so quickly. But again, thank you for all your questions. They've been fantastic. Going over the headlines, vaccine, Moderna got its emergency use authorization. It's starting to get distributed. Shots are going to start going into arms here fairly soon. CDC has decided on what categories to go next. They did phase 1A, which are healthcare workers and those in long-term care facilities. They're doing phase 1B, which are 75-year-olds and above, and essential workers, which are the first salvo of essential workers, which are basically first responders, those working in the grocery and the food chain, anywhere from farmers all the way down to grocery store employees. And then 1C will be 65 to 74-year-olds, 16 and above, who have underlying health conditions, and other essential workers, teachers, lawyers, media, those type of people that are going to work, keeping society going, and need to get the vaccine sooner rather than later. But for everybody else, probably springtime before you get it. But the important part is to make sure you do get this vaccine. This is a big holiday week, and so please stay safe throughout this week, especially obviously all the experts are saying, don't travel, don't be with people who aren't living under your roof actively, do a lot of things virtually. If you do, though, make sure you take all the safety precautions before and during your travels, and particularly when you get back, to try and prevent the spread, because you saw on Thanksgiving we had these huge spikes. Probably going to have the same thing after these holidays. We just need to be extra careful. But in the meanwhile, please stay happy, please stay healthy.